Well, I want to thank the Vice President. I want to thank Secretary Azar, Dr. Hahn, Dr. Birx for coming down to Florida, also just for all the help that they provided throughout these many months. We are now in a situation where we are testing a lot more. We also have a greater percentage of people testing positive. I mean, throughout May and early June here in Hillsborough County, for example, I think they were testing at about 3 or 4% would test positive. Now we're looking at places like Hillsborough and Orange County, no longer 3, 4%, but now 15% of folks are testing positive. Obviously, when you're testing about 60,000 people a day, we're getting results like that over the last week. That's going to generate a lot of additional cases. So we were discussing some of the things that we may be able to do going forward, including pooling types of testing in conjunction with our universities, which I think will be really, really good. We also spoke with some of the hospital systems here, Tampa General, Baycare, about other ways that we could be helpful. One of the things, if you go back to March, when we kind of faced the initial wave of this, I mean, we had very few tests relative to what we have now. Now hospitals test anyone that comes in for something they can test. We, between the state, we're doing 10, 15,000 tests a day at all the different sites. There was a question about PPE. We've got PPE, hospitals have it, state has it, we're good to go there. There was no treatment of any kind really for this. It was totally novel. The physicians have learned a lot, and then through Secretary Azar and HHS, I remember coming down, I think at the end of April, to visit Tampa General. They asked about remdesivir. We called Secretary Azar. They've been sending a bunch of the remdesivir down, so the physicians are using that. They're using convalescent plasma, and they are having definitely better results. And then we also, even though we took a lot of action early to protect the long-term care facilities, since March, we have increasingly brought on COVID-only dedicated nursing facilities. And so we now have 12 of these facilities throughout the state of Florida. We have one in Pinellas, one in Polk, which the Tampa Bay hospitals can use and nursing homes can use. And basically the idea is if you have somebody test positive in a nursing home, you don't want that to spread to the other residents. That individual's medically stable. They could be transferred to the COVID-only facility. If they need hospitalization, obviously they go to the hospital. But if they end up becoming stable while in the hospital, rather than be discharged back to that facility, which would create problems, you have a place to go to be able to discharge that. So all around the state now, we've got 750 beds in COVID-only nursing facilities, and so we just brought one on in Miami. We now have one in Broward, 2 in Palm Beach, 2 in Southwest Florida, Brevard County, Jacksonville, Escambia, and Tallahassee. So pretty much anywhere around the state, if you have somebody who is a resident of a long-term care facility that's in the hospital, that's medically stable but still contagious, you have a place where they can be safely transferred. So we think that that's something that's very, very significant. The message that we've really been sending for folks in Florida, I think because we had such a quiet May, because the positivity was so low, the caseload was so low, it kind of fell out of the news at the end of May, beginning of June, and I think people weren't as focused on it anymore. And now obviously we've seen these cases, so I think people are more focused on it. But basically the message is, for those folks who are 65 and older, people that have significant underlying medical conditions, do your best to avoid crowds and minimize close contact with people outside your home right now. We have the virus community transmission, particularly with younger people. If you look at where you go back a month, the median age of our cases was in the 50s. Now the median age of the cases here in Hillsborough County for the entire pandemic has dropped to 34. And there'll be days where we'll get cases in Hillsborough County and the median age will be under 30. In Orange County, the median age for the whole pandemic is now 32. There's days where it'll be 28, 29. So it's been a huge shift. The case growth has really been in that 18 to 34, 35 age group. Now, those are folks that are by and large going to be much less prone to significant consequences. Nevertheless, with the increasing positivity rate, it's clear that you're seeing more and more community transmission really being driven by that age group. And so, if you're someone in one of the medically vulnerable conditions or you're an older person, just understand that that's out there. Continue to be vigilant. I think folks in Florida, the seniors have been very, very vigilant throughout this whole time. We still want to ask people to be able to do that going forward. And then for kind of the general public, we're telling people to avoid the 3 C's, close spaces. In Florida, it's hot. People don't want to be outside in the 95-degree heat. Just understand, if you're getting together in closed spaces with poor ventilation, that is going to be a much better vector for this virus to be able to spread. We're also saying avoid large crowds. Now, we had for a long time a 10-person gathering limit. We've advised, not to do more than 50, but I would say the smaller the group, the better for that. And then also the close contact. If you're in really close sustained contact with somebody, you're going to be more apt to see transmission of this virus. So avoid the 3 C's, stay safe, and take care of yourself during this holiday weekend. I want to bring up the Vice President, just thank him. He came down, I remember at the very beginning of this in March. We went down and met with the cruise line folks, has always been there to help us as we've needed different things. And, we have needed things from time to time. And so I really want to thank him for being a friend to the state of Florida, being a friend to the people of Florida, and really never leaving this fight. I mean, even as we saw numbers go down across the country in May, now we see a Sun Belt resurgence. And he's been, I think, all over the Sun Belt just in the last few days. So we've already discussed ways that they can help Florida going forward, and I know that they're going to be able to deliver on that. So it's my really honor to be able to welcome yet again to the state of Florida our Vice President Mike Pence.
Well, thank you, Governor DeSantis. Thank you for your leadership. People of Florida deserve to know that from the very beginning of this pandemic, Governor DeSantis and his healthcare team have formed a seamless partnership with our entire White House coronavirus task force. And whether it be in testing, whether it be in personal protective equipment, whether it be in the distribution of therapeutics like remdesivir, or whether it be in advancing the kind of mitigation efforts that have kept Florida low for a long time until just a few short weeks ago. Governor, I want to thank you. Thank you for your leadership and your partnership, and I want to thank all the people of Florida for all of your efforts over the many months, and to say to each and every one of you what we said to the governor today is we're with you. And at President Trump's direction, we're going to make sure that your governor and the state of Florida have what you need when you need it to meet this moment of rising cases across the state. We really are here to assure the people of Florida that as we see the rising cases not only in this state but across the Sun Belt, that we're going to do whatever it takes to make sure that our extraordinary healthcare workers have the resources and the support and supplies. The governor and I talked today about personnel, and we'll be considering a request from the state of Florida about medical personnel that we'll be processing in very short order. Governor, I also want to thank you for your efforts. I want to thank you for your efforts to open up Florida again. We had good news this morning as a nation. Nearly 5 million jobs created in the month of June, including many here in the state of Florida. It was the largest one-month increase in history. And Florida, being an economic engine for the United States, played a key role in that. But I also want to say, Governor, that we fully support your prudent steps in working to slow the spread and the rising cases that are impacting Florida today. As we said in a task force meeting not long ago, and I'd say to the people of Florida, it's not an either-or choice. If all of us will put into practice the guidance from state and local officials, which is wash your hands, practice good hygiene, wear a mask when it's indicated by local officials, or wear a mask when you can't social distance, We know that we can do what Florida did for those many months and what other impacted areas around the country did. We can slow the spread. We can flatten the curve. But it'll take all of us to do it. And I just want to assure you, Governor, that we're going to be working with you to make sure that Florida has all the resources. The economic comeback that's underway is a demonstration that we don't have to choose between opening up America and the health of our people. We can do both, and that's the challenge that we face today across the Sun Belt. And we just want to encourage with great respect all Floridians to put these principles into practice and know that we're going to stay with you every step of the way. I do want to say that we're encouraged today to hear a report from the governor that particularly in the category of personal protective equipment for healthcare workers that Florida's hospitals are in good shape. We also are pleased to hear the hospital capacity remains strong in this state. We're informed there's about more than 13,000 total hospital beds available at this time. Availability 22% of hospital capacity. Ventilators, which were an issue before our nation 4 months ago at the beginning of this pandemic, are in abundant supply. We're told that there's more than 5,500 ventilators available across the state of Florida. But at President Trump's direction, we worked with companies across the country. We're well on our way to manufacturing 100,000 ventilators in 100 days. And in just a matter of the next 2 weeks, we'll have 50,000 ventilators in the strategic national stockpile. And should the need arise anywhere here in Florida, we want to assure you, Governor, and all your healthcare workers that the resources will be there. We were also encouraged to hear that personal protective equipment remains in abundant supply in the state. The federal government has shipped literally millions of N95 masks, surgical masks, face shields, gowns, and gloves, but we'll continue to make sure that those resources flow to the great healthcare systems that we had the opportunity to meet with today. As you'll hear in a moment, too, from the director of the FDA, Dr. Stephen Hahn, we're also making steady progress in distributing therapeutics or medicines to treat people that are suffering the symptoms of the coronavirus. And I'm pleased to report to your governor today that just yesterday the latest shipment of remdesivir arrived in Florida, 34,000 vials of remdesivir that will literally treat thousands of patients in this state. That combined with other innovative treatments like steroids and convalescent plasma, we literally are we're in a much better place than even 2 months ago to be able to treat people who've contracted the coronavirus. And I hope that that message more than anything else comes through today to the people of Florida, is to understand that that we are, because of all we've done as a country, because of President Trump's leadership in standing up a whole of America approach, manufacturing supplies, innovating in testing, developing therapeutics, and well on our way to developing a vaccine. We hope and trust, perhaps even by the end of this year, that we are in a much better place to confront the rising cases that are impacting here in Florida and all across the country. And so I want people to be vigilant, but we want people to be encouraged that we're going to make sure your governor in the state of Florida has everything you need to meet this moment and do what Florida's been doing from the very beginning, and that is putting the health of the people of this state first. And let me also say, with great admiration to the people of Florida, that the record of Florida in protecting the most vulnerable is among the best in the nation. And Governor, your steps to protect residents of long-term care, to create those COVID-only facilities, to do the kind of testing that's the record in Florida really speaks for itself. And we commend you for that, and we'll continue to support your efforts. Governor, President Trump and I are absolutely committed to supporting your efforts to respond to this outbreak in Florida, to slow the spread, to protect the vulnerable, to get our kids back to school, and to keep opening up our economy. But lastly, let me say to all of my fellow Americans all across Florida, we all need to do our part. And we once again want to specifically encourage younger Americans in Florida. It's one of the unique things. I was in Arizona yesterday. I was in Texas over the weekend. And as we discussed with your governor, it's a truism of this moment in the pandemic that some 50% of all the new cases are Americans under the age of 35. And to each and every one of you, let me just say from my heart, I know you know that without a serious underlying health condition, that the threat of the coronavirus to younger Americans is very, very low. But no younger American would ever want to put at risk a grandmother, a grandfather, a mom, a dad, an elderly neighbor or friend by inadvertently exposing them to the coronavirus. And that's why we encourage you to be vigilant, to heed state and local guidance, and to respect those who are most vulnerable in particular. And just know that if all of us do our part, we'll get through this. I can't help but feel that the resilience and the strength, the character of the American people shown forth today, that even in these challenging times, we're continuing to see America's economy coming back, America going back to work. And I'm just absolutely confident. If all of us do all that we need to do, we'll do what we've done before in other parts of the country, and what Florida did for so many months. We will slow the spread, we will flatten the curve, we will save lives, and we will bring Florida and America's economy back bigger and better than ever before. With that, I'm going to invite to the podium a couple of members of our team. Dr. Deborah Birx, been the White House coordinator, been our lead scientist on all matters, and after her, we'll hear from the Secretary of HHS briefly and the head of the FDA to share with you what we heard today, what we're seeing. But Governor, once again, thank you for your leadership, and to all the people of Florida, we're with you, and we're going to stay with you until that day comes that we put the coronavirus in the past here in Florida and all across America. So thank you, and God bless you.